welcome everybody. Thank you so much for joining on in. So now we have Meera Duncan, and she's talking about hypnotherapy for bipolar disorder. And she's got the studies, she's got the physicians, she's got the book, she's got everyone behind her. So here she goes. But she's a bit nervous because she's not real good with technology. So if she fucks it up, don't worry about it. We'll work it out. Okay. And if you have any questions, please ask during her talk, because she wants to make sure that, everybody has clarity as she's talking, because it is rather clinical and a little bit in depth. So take it away, Meera. Go for it, darling.
Thank you, Trish. I'm just going to screen share here and start off with the slides. Okay, can you see that, Trish?
Yep. Looking good.
Okay, perfect. Okay. Okay, thank you so much for having me today. It's your conference is such a wonderful forum for therapists to contribute their research, their work, and really their passion.
Oh, thank you, darling.
Yeah, you're welcome. So as Trish mentioned, I have been, since publishing my work and my research and my book, I have been working so much with physicians, with psychiatrists, and treatment plans with patients with bipolar disorder that my presentations have gotten extremely clinical, involving metrics. And in watching a couple of the wonderful presentations today, I felt like I probably need to omit quite a bit that I had prepared. So there's just a few that I really a little bit of information I want to hold on to. And after that, we can just engage and discuss. And I'm, absolutely welcome any questions you may have. So in beginning the presentation, as we said, it's treating bipolar disorder with hypnosis, exploring the 5 stages of environmental stress targeted therapy, EVSTT, and its genesis. Who am I? And I want to discuss as well how I fell into hypnotherapy. I'm a registered clinical counseling hypnotherapist, author, counseling therapist, addictions counselor, and founder of Environmental Stress Targeted Therapy. I live in Calgary, Alberta. I'm in private practice here in Canada, and I'm on the board of directors for ACTA, the Association of Counseling Therapy of Alberta, and the board of directors for FACT Alberta, the Federation of Associations of Counseling Therapists in Alberta. This year, I was nominated to receive an honorary doctorate of advanced studies in psychology due to this research and work. And I'm just excited just to be nominated, that my research and work will be recognized and is being recognized, because it's really about the work. And and how I fell into hypnotherapy. I'm actually extremely spiritual person and was not that clinical back then, but was in an elevator accident in 1998 at my place of work. And sorry, it just went out. At my place of work, and was severely injured from that accident. It was actually hypnosis, self-hypnosis, autosuggestion was the only thing that actually stopped the debilitating pain that I was in for over a decade. And that led me to becoming a hypnotherapist. That led me to my true calling. And I just want to take a moment to discuss what bipolar disorder really is, because so many people don't have a real understanding of this disorder. It is a very complex genetic disorder. Bipolar 1 requires a history of at least 1 manic episode, and bipolar 2 requires a history of 1 major depressive episode and 1 hypomanic episode. And as I said, it's a complex genetic disorder characterized by dramatic or unusual mood swings between major depression and extreme elation accompanied by disturbances of thinking, distortions of perception, and impairment of social functioning. The mood swings of bipolar disorder can range from mild to extreme and can come on gradually or suddenly within minutes to hours. Moving into my research now and how it became the genesis to a new approach for clients with bipolar disorder, I'll begin with a brief discussion about the very first client with bipolar who strolled into my office for help with her episodes. She had recently been diagnosed with bipolar and was seeking psychotherapy that incorporated hypnotherapy and hypnosis to reduce her high levels of anxiety and stress and to possibly reduce the duration and severity of her manic and depressive episodes if possible. Since I had had no previous experience or specific training utilizing hypnosis for a patient with bipolar disorder, I searched through hundreds of textbooks and studies in an attempt to locate past uses of hypnosis for this type of symptomology and diagnosis. But I couldn't find any such treatment, therapeutic model, or case study. Absolutely nothing. Hypnosis is one of the safest, most natural methods of healing that have been used for thousands of years by clinicians as well known as Sigmund Freud, the very founder of psychoanalysis. So I was astonished to discover that a treatment incorporating hypnosis and hypnotherapy had not yet been established. I then began to craft my own treatment protocol, incorporating fundamental theories established in hypnosis and hypnotherapy, and discussed this experimental approach with her. She chose to commit to the therapeutic treatment plan that I had created, which on a theoretical level was quite basic in its ideology. We proceeded along a plan of combined counseling, cognitive behavioral therapy, and clinical hypnosis to attempt to achieve her therapeutic goals. Next, in addition to other significant traumatic events in her life, we identified the initial sensitizing event, the ISE, and the secondary sensitizing events, the SSEs. Specific triggers and associations connected to her very first episode and other significant episodes that were manic, hypomanic, or depressive in nature. After only 3 months of weekly treatment, her episodes were less severe in nature, reduced in number and frequency, and more manageable, and her climatized and acute levels of stress and anxiety were greatly reduced on a daily basis as well. These initial results far exceeded my expectations. How could a treatment for such a complex mental illness, a treatment model in its most basic form in infancy, prove so effective and life-altering for this client? I began to immerse myself in research on bipolar disorder and eventually stumbled upon an answer that leaped straight off the page and into my consciousness. In case study after case study, there always seems to be an external stressor, a traumatic event that preceded the initial episode, which was either manic, hypomanic, psychotic, or depressive, and usually occurred during the late teens or early 20s. The components of causation are believed to be strongly linked to genetics and the biological chemical imbalance within the brain, an alteration within the neurons and their ability to transmit. Yet it always seemed to be activated initially by a traumatic event, one or more significant fight or flight stress responses. The traumatic event seemed to flip a switch in the predisposed individual, therefore activating the group of genes connected with this illness, activating the actual onset then of bipolar episodes with this chemical change within the brain. Here, my own theory of causation, linking the fight or flight stress response to the genetic and biological manifestation of this illness, began to take shape. The environmental stress theory of causation, therefore formally labeling my discovery and breakthrough. I then began to develop a treatment protocol that focuses on this environmental stress component that is strongly linked to the genetic and biological components discussed earlier. I have since coined this psychotherapeutic treatment protocol environmental stress targeted therapy, or EVSTT. And this is the very first psychotherapeutic treatment method that includes the use of hypnotherapy, and perhaps the very first method that truly focuses on treating and completely desensitizing the triggers and associations linked to the manifestation of these episodes, such as manic, hypomanic, or depressive. So in 2019, I then conducted a small clinical research trial of this protocol, yielding positive and dramatic results that were both unexpected and, quite frankly, jaw-dropping. Publishing my work for other therapists to utilize was the next logical step so that patients with this disorder can receive this treatment and experience the improved functionality, mood, living more productive and happier lives. And now treating physicians can understand and finally acknowledge that clinical hypnosis is a very safe and effective psychotherapeutic treatment option for clients with this disorder. And since concluding my clinical research trial and publishing my book, I now work with many of the bipolar clients treating psychiatrists to establish and maintain optimal treatment plans and update them on our session progress. Trish, I'm on the iPad, so when I'm screen sharing, I don't see any chat box. I'm just wondering if there are any questions right now so far.
I'll let you know if anyone posts any questions, so you're all good.
Okay, perfect. Okay, so as we move to this slide, um, let's take a look at how hypnotherapy is effective in managing bipolar disorder. So it's important to note what it cannot do as far as altering a patient's genetic or biological components of causation. However, it will desensitize the stress responses and triggers that are embedded in the subconscious that are connected to the episodes. It will alleviate or reduce those fight or flight stress responses that trigger an episode. And it dramatically reduces the severity of episodes, increasing the maintenance phase between episodes. And here I just highlight some of the quotes, the research that I found so critical, so foundational when we look at what the connection really is between bipolar episodes and trauma. So I'm just going to give you a moment
So,
to look
Mira,
through those. Yeah, sure.
Val's just asking, are your clients constantly medicated for BPAD while experiencing your therapy? So are they still on
Some,
medication?
some are and some aren't. As I am not a psychiatrist, it is not my place to tell them to stop taking anything or to start taking anything. And so I leave that completely up to the treating psychiatrists that they are seeing. And so that is solely up to them. I work with both. I have clients come in and say they don't take any medication, and we see dramatic results with reducing their episodes. I have clients that continue following. Typically, it's lithium, but there's actually a whole gamut of different medications that they can be prescribed. But they, that will stay on them and will still come do hypnosis, do EVSTT, go through all of the treatment and continue to see me for so far, years and years, and experience dramatic results. But some choose to stay on their medications because that's what their treating physicians really want them to do. And so I'm not qualified to even comment or give them advice regarding that. That's between them and their psychiatrist.
And what about clients that are choosing to take something natural? Because some people, they might take flaxseed oil or something like that. Do you make recommendations on any of that stuff or just let them go along with what they're doing?
I really like to leave that up to their treating clinician. However, I am, for me myself, I'm vegan. I everything I put in my body is so important to me. I'm extremely spiritual as well,
Mhm.
and it's really a personal choice. And then doing the research, there's not a lot of conclusive research as of yet as to natural methods, what you can put in your body that
Yeah.
might help with that, that chemical imbalance within the neurons within your brain, that the biological aspect. And so yeah, I, I I like to give them just health tips as to what, supplements obviously help with depression and what helps, but they really need to, there are some interactions that can occur with different medications. And
Mhm.
as I said, there are actually quite a few medications that the physicians can pick and choose and change and alter and alter dosages. So that's not my place. So,
No,
yeah.
thank you for that. Because in Australia, we're not
Sure.
allowed to say anything about medication or anything like that. That is up to the physician, sort of thing.
Absolutely.
So yeah,
Yeah,
thank you.
absolutely. Yeah, sure. Okay, any more questions before we move to the next slide?
Yep. No, that's it at the moment.
Okay. Okay, let's just move to stage one then. And let me just get my notes up here. Okay, so stage one is really about assessment. Contacting before you even see the client, it's so important to contact their treating physician, their psychiatrist, just to get all of the information, all of the reports that have been done to date. I really like to do that and go through it all because some of them can be 15, 20 years ago, and they haven't had any new testing done, and the testing is important to see what needs to be done,
I
what
was just
work needs
asking
to be
that
done.
in the chat as well. Are you
Oh,
required to
perfect.
advise each client that they must contact their treating specialist before undergoing your therapy? We are ethically not
Uh,
allowed to treat them, such clients simultaneously without doctor awareness, at least to her
yeah,
understanding.
okay. Yes, ethically, absolutely. That's part of it as well. Absolutely. I always contact. It can take some doctors a good. I've had actually one client from my study in 2019. Uh, she she sent in, the consent form, and it took 4 months
Oh,
for them to just send me the reports. So it was extremely frustrating. We ended up, I had to take her out of the study because my deadline, I couldn't meet the deadline by starting her sessions, 4 months into the study.
yeah.
It was unachievable. It just, we couldn't do it. So I actually had to take her out of the study, which was really unfortunate.
Mm.
Oh, you wouldn't, I got to tell you another thing. What you wouldn't believe, one other patient from my study in 2019, I got all of the details, all the reports from the treating psychiatrist. So we were a go and we started working, and 3 months in to his treatment, his psychiatrist changed his mind and decided he did not have bipolar. And so I had to take him out of the study.
Mm. Yeah, I've had
It's
things like that as
crazy.
well.
Like,
I've even had doctors
yeah, like,
just suddenly just go, "No, I don't want my patient working with you anymore." And I'm like, "But
ugh,
stating they're
ridiculous.
feeling amazing, they're conquering the problem."
Exactly.
So yeah,
Exactly. I
yeah,
mean,
I'm hearing you.
as you know, it's so natural. I mean, we're in a natural form of hypnosis each and every day. This is natural. It is ridiculous. They have so much fear for hypnosis. Well, some, I shouldn't say they, some do,
Yep,
which is unfortunate. And that's what drives a lot of these psychiatrists, you know, um, to just say, "Oh, I don't think you should do that," and try to steer them away from something that's really helping them.
yeah, yep.
And that's why I'm so passionate about my research. As I said, I couldn't believe the change. I couldn't, basic. It was so basic. And then when I linked, which I kind of, yeah, I took that out of my lecture. But when I linked, I'm so worried it's too clinical. When I linked the candidate genes, the doctors link, they did this, all of these studies on which group of chromosomes, of genes, are linked to bipolar disorder. And so this is a lot of the research that I was reading and reading and reading back in 2018, 2019, when I was forming my treatment protocol. And I could not believe, so these specific group of genes called the candidate genes, they are linked to the stress response, to the amygdala part of the brain.
Yep.
It's crazy. Like it's so obvious,
The
the
amygdala is
connection.
so powerful.
Yeah. And it's so obvious. So when you look at, and this is kind of how I put together, you know, my whole theory of causation and my whole theory, my whole treatment protocol was when I started seeing all of these connections, physiological, direct connections to the fight or flight stress response, to those triggers that clients will have just before that very first episode. I couldn't believe it. I'm like, how has nobody seen this before?
Well,
Because this is obvious. Like, it's
we're
obvious.
we are a bit
And so,
biased in the hypnosis community. A client cured is money lost in the medical industry, isn't it?
yeah,
So yes, in answer to
absolutely.
Val's question, yes, by all means, please have the physician on board so you
Please.
can assess the medical reports. Definitely.
Yes, yes, absolutely. On board and discussing, but I don't request permission. I
Mhm,
made that mistake during my clinical research trial,
mhm.
because then I had issues with certain psychiatrists not, then refusing for permission. So I switched it to just letting them know what I was doing. Let's discuss. Let's talk about their treatment. Let's update each other, each
That's what
week
I
or
do. I
monthly.
I kind of do
Yeah,
reverse referral where the client comes in and I say, "Now
exactly.
give this
Yeah,
letter to your doctor if you." You know?
exactly.
So
Yeah,
yeah, I
exactly.
get it.
And I mean, yeah, it's what you have to do until it becomes well known, like I said, which is why I felt like I had to publish my work.
Yeah, makes
um,
sense.
this that there's even, in my book I've got the case studies in there, and I talk about, I called her Jody, one of the clients from my research trial in 2019. And I mean, her results were literally jaw drop. Like, I couldn't believe it. Her psychiatrist couldn't believe it. Like, she had a 30-year documented, like, well documented
Oof.
history of bipolar 1, you know um history of psychosis. Like, her case was so extreme, so severe. Her history was so severe. She's definitely, what I thought in the beginning would be my toughest client
Mhm.
because of her history. And I could not believe the change, because her average was 6 months to 12 months for a depressive episode each and every year for 30 years.
Sheesh.
And so, we thought, okay, she's done everything you can think of. She's, electric shock, everything you can think of. She's on all the medications, high doses. It's Her case was extremely severe. So I thought, okay, let's just do this. You're on board. She's like, yep. I told her, I got to tell you, I've only worked with a handful of bipolar clients to date. That's why I'm doing this. This is the first time I'm trying out um, this kind of new treatment protocol that I've really enhanced from what I've done in the past. And are you up for it? It's an experiment. And she's like, yeah, let's do it. And she came in with one, and we were probably halfway through her sessions, and she began a depressive episode. And like I said, hers were severe and, really would usually last 6 to 12 months. Nothing ever reported lasted shorter than 30 days in 30 years. And with, all documented by a psychiatrist. And she came in, and right away I was like, okay, what's going on? And we started doing the CBT. We started doing the homework. We did it in session. Her depressive episode ended that day, which was 2.5 days total.
Amazing.
And she has not had another depressive episode since that one in 2019.
Beautiful. Absolutely
It's
gorgeous.
it's like, how do you, like, it's like, I still don't believe it when I say it. Like, and the psychiatrist is well aware, and this is what and this is just from really doing the hypnosis,
The
the
psychiatrist has lost their bread and
counseling.
butter.
Yeah, yeah. Well, let's hope. We need them. We need
Bending
them.
and
I
broke.
appreciate them. We need them. But yeah, I mean, to add a treatment modality that can really help with with healing, because it's really about, honestly, like, my my work. And when I started this work with this illness with clients, it comes down to the basics: healing and desensitizing that fight or flight stress response, dealing with anxiety and resolving it. So many therapists, especially, psychologists, they they treat the symptom, but they don't actually go to where it's stemming from and
Yeah, they keep
resolve
going in
it.
circles.
Yeah. And whereas we resolve it as hypnotherapists. We go to where is it really stemming from? And then we desensitize those triggers. We reframe, those incorrect belief systems, those distorted negative automatic thoughts, and it is incredible, the evidence that I have now experienced and witnessed and seen from clients when we just do this basic work,
Mhm.
you know, um, with clients with this specific complex illness. It's crazy, like, because everything is so heavily intertwined. Everything is linked
Well, keep
physiologically, emotionally. It's
well,
connected,
well, keep taking us
and
through
so
the stages.
that's okay. Sorry. Okay,
You're right.
so I get excited.
Oh yeah, that's a good thing. That's a good thing.
Yeah. Yeah. Okay. So as I said, I'm sure I've been talking for a while, so I'm sure you've had a chance to review. Stage one is really about intake and assessment, and just gauging, where is your client now as far as the episodes? What are they? How long do they last? Describing, the template of episodes, because you would be surprised at how many clients actually don't understand, like, what to expect from each episode. Some clients, have been diagnosed for over a decade and still don't know really what signifies them being in a hypomanic episode as opposed to a manic episode.
Yeah.
So just going over that educational component, and then just going over, and like I said, you don't have to do your own charting and test everything. But if it's been like 10 years, 15 years, 20 years since they've even discussed it, or really took a look at it, it's a good idea just to gauge. And then it gives you a great basis as to, okay, let's start to really see how often you're having them, how severe they are. It just really helps with understanding and with the client's understanding. So that's also like 50% of it. All right, let's move to stage two. Okay, so stage two is really about forming that treatment plan. And so really identifying, like we said, just through talking, what the ISE is, what the SSE is for those first episodes and subsequent episodes as well. Because I always like to really work on what I found is, any traumatic memories, any fight or flight stress responses, any traumas in the past um, really should be worked on to heal, to desensitize. And so identifying all of that, even if you think, oh, I don't know, when they were 10, this happened, but then you really start to talk to them and say, gosh, is that when your panic attack started? And then they may say, yeah, it actually is. And then start to really identify, what are the triggers for that specific fight or flight stress response? What are the associations that have been created subconsciously? Um, just where is it really stemming from? What automatic negative thoughts are they saying to themselves, thinking each and every day that perhaps they haven't even connected yet? And then we create the treatment plan to really work on everything we've identified. And also, like I said before, just in this phase, I always give them the information fact sheet that you can create yourself. Like we said, that it's really important to make sure that they're educated on their diagnosis. They understand what's happening. It really leads to acceptance as opposed to fighting it and feelings of shame, self judgment, which are so hurtful and damaging and clients continue to really traumatize themselves if they're shaming themselves and judging themselves when they really realize, well, this is just my brain functioning differently. Why would I judge myself over that? And so okay, so now we move to stage 3. I know I see we're running low on time, so I will go through this one a little bit quicker, hopefully. So stage 3 is more about the acceptance and cognitive reframing. It really focuses on the counseling, on the talk therapy, on the CBT, so that cognitive behavioral therapy, which is so important, as we create this foundation before we start really doing the EVSTT hypnosis. And then, yeah, giving the homework assignments as well. That's mainly based with the CBT in this stage. Are there any questions about stage 3?
We're all good at the moment. Thank
Okay.
you.
All right. You're welcome. Okay. Let's move to stage 4. And this is the fun stage. This is what we do. This really focuses on beginning the hypnosis. Working through to resolve, to desensitize, to heal any traumas, any associations connected to any episodes, whether they're depressive, manic, or hypomanic. Um, we, and I'm sure a lot of people here today are hypnotherapists, and I mean, this is really what we do, and that's why I really believe it's really so basic, in its form. And that's why it's so shocking that why hasn't this been, formed yet? Why aren't people doing this? Why? Because the evidence shows that it works, just like it works for treating anxiety, just like it works for treating phobias, PTSD. It all has to do with that fight or flight stress response when we look at anxiety, when we look at PTSD, and everything is just so heavily intertwined physiologically and emotionally and psychologically. So yeah, so this is kind of, yeah, the bread and butter of what we do as hypnotherapists. All right, so now we move to the final stage, stage 5. So in this stage, we're completing any clinical hypnosis. Um, Parts there, I do want to note that every single client in my research, my clinical research study in 2009, um, did have sexual trauma. And that was a surprise for me that that number was 100%. I can say since that ended, and I just continued to work with more and more clients um, with this illness, that there's a few that have not had any type of sexual trauma. But it is surprising to me that so many have. And so that's the reason it's in the book, and that's the reason that I've noted here that, if a patient has had sexual abuse during their childhood or early years, or, typically for everyone in my study, it was during childhood. It's so important to make sure that they want to heal this pain, that they want to start working on it. Never, never work on it if they don't. So if they are ready and they want to, it is so important to make sure they know the work we're going to be doing. And then what I do is I really love to do parts therapy, healing that inner child when we do this work. I utilize a squeeze ball that's very symbolic of the energy of the release of all of those negative emotions that are, I mean, there are so many that are tied to this type of trauma. And um, we really just work on releasing that pain, letting that inner child know the other parts are older, wiser, can now protect, and it's safe. It's now safe to let go of those feelings of pain if you would like to. So that is an important part of this stage if the client has that type of trauma and if they want to do this work. Um, we then move to, doing other work, what is left. So we talk about comorbidity in this stage, which just means other diagnosis like anxiety disorder, or insomnia, or whatever comorbidity, the client may have. And that's when this stage, we start to work on that. If there's any remaining panic attacks, any remaining climatized level of anxiety, any insomnia remaining, anything like that, this is where we do the work in hypnosis. Um, and we then move to what Dr. Miklowitz has created, which is really a family focused therapy session, which can go on for months or it may just be a handful. But we like to bring the entire family in to make sure they understand everything about this diagnosis as well. Because again, I couldn't believe that, with so many clients that I see, their families, and I'm talking about spouses, I'm talking about, grown adult children, I'm talking about the closest people in their lives really did not understand what this illness is and how it affects them. And we can only support, love, and nurture, the people we love and care about if we understand what's going on with their health, if we understand what to expect, what's normal, and oh, maybe we should let them know, oh, it sounds like you might, be going into a hypomanic state. Do you think you might be? And then sometimes the client will be like, oh, I am. Wow. Okay, I'm going to go see Meera, or I'm going to go see my hypnotherapist, and, make sure we start talking, and so that I really love his family focused therapy that he created. It's really conducive to including your loved ones, which is healing in itself. And then, yeah, just working on a prevention plan together, which again is really about identifying um, what my triggers are. If I have bipolar disorder, what are they? And it really helps because once you can really see when you're going into an episode, I mean, it takes the pressure off. It takes like 80% of all of the pressure of all of the anxiety away because it's just, oh, I see what's happening. Got it. Okay. I'm going to go see my therapist. I'm going to make sure I'm taking care of myself. I'm mindful, what to expect. And, it's dramatic how much just even understanding and creating this prevention plan as far as identifying and moving forward for the rest of your life in healthier, happier ways, how it affects every part of your life. When you're prepared, when you understand, and you know how to deal with it, it's empowering. And okay, so that's the end of stage 5. Oh, were there any questions about stage 5?
No, we're all good at the moment, thanks God.
Okay, so this is just a quick little write up of the homework that I typically give throughout the entire treatment protocol. The genogram for the family of origin is helpful just because we are able to then see the genetic link, which is just helpful, just to see, oh my gosh, now I realize my grandfather had bipolar and my aunt has bipolar. And, it's just helpful for the client to see that. So it, it's more of a fun task. They get to go home and create a family tree, and people actually enjoy it because you learn about your history, you learn about your family and your heritage. There's so much more that you get out of it than just seeing if there's a genetic link or not. Most of my clients love to do it. If they don't want to, they don't have to. None of this is mandatory, or a requirement. These are just suggestions in the mounds and mounds of research that I did when I was forming environmental stress targeted therapy and what I found helpful. And, like I said, everything is you discuss with the client, like we always do as therapists, and say, I suggest this. Would you like to do this? I should mention a lot of the mood track charting and the interpersonal social rhythm charting and the sleep wake charting clients do not want to do and do not like to do. It is not mandatory. Um, Therapists really like it, psychiatrists really like it, just because it identifies. Sometimes I'm sure with anything, people don't always recognize what's really going on in their daily lives. And so sometimes it's just helpful to notice what is, some people say, I have insomnia. But then we'll notice they only have insomnia when certain things, like whenever they visit their mom, for example, and like the night before, which really has to do with anxiety that's creating the insomnia, right? So as far as like, it's more about identifying and being able to point it out to the client, say, hey, since you did this, what's going on this day? How come, twice a month this happens and yet we're not seeing this other days? And then they'll, oh, this is what's going on. And so it's just helpful that way, but of course it's not required. And if they don't want to do it, they certainly don't need to. I just always explain what the purpose is for it and then let them choose. And then, yeah, the anxiety ABCs, I love to give clients information because I find that, and for any client, whatever they come in to see me, if they have any type of anxiety, I find that a lot of clients don't really truly understand what's going on physiologically when they're having a panic attack and how it's triggered and what that feedback loop really looks like. And so I always give them that information and how it can empower them and they can actually reduce, those time frames when they're having a panic attack through the CBT because of the feedback loop and through diaphragm breathing and then redirecting. And so it's again just empowering them, giving them tools. And then, of course, I love the EFT tapping. I've been, working with my clients for over a decade and always teach them the tapping. I do it on myself. I love it. It is again another tool, that clients need to have. And again, for desensitizing any stress responses along with the clinical hypnosis we do, is very effective and gives them that tool to go home with and utilize anytime they like. Um, Trish, any questions about the homework?
Oh, I think that's amazing, honestly, Dal. It jogged my memory about Jordan Peterson. I've watched a lot of his work as well. And he talks about when it comes to CBTs, sometimes it's about recognizing the monster that's within and then breaking it down even smaller. So if your client comes back and hasn't done it, then break it down even smaller because they may
Absolutely.
actually get so overwhelmed by the thought of doing it that they need it to be made smaller, but that's good because they've recognized the monster.
Exactly, exactly. And for when I work with clients, I find a lot of times they really don't know how to do CBT. And a
No,
lot
they
of my
don't.
clients will have seen a psychologist for like, years and years and years.
Mm.
And I'm like, okay, tell me what you're doing for CBT. And they're like, I don't really know, and then they'll go into a vague kind of, kind of had to do this, like, oh man. And I'm like,
Yeah,
okay,
yeah,
so I want you to tell me every single, negative thought you feel when you start to feel anxious. We're going to write them down. Let's do this together. And
yeah.
then just really dissect it and
Mhm.
reframe it together.
And that's it.
And then I love, oh, sorry, go ahead.
And that's what Jordan Peterson was talking about. Like he said how he had a client who he lived in a hoarding situation, so he was in complete filth. And what he did was he got out the vacuum cleaner and sat it in the doorway and then proceeded to walk over the vacuum cleaner for 16 months. And then when he actually saw him, he's like, look, you've recognized that the monster within, you recognize that you have to get some cleaning done. However, it's been too much of an effort. So you kept stepping over the monster. So instead of thinking it as we've got to clean the whole house, how about between now and the next session, you just clean out one sock drawer?
Oh, fantastic.
And that's all he did.
Yeah.
And it comes
Mhm.
down to the 5 second rule then, because once you kind of start doing something, you get into a role, all of a sudden you've done two sock drawers or the bathroom.
Absolutely.
I use this with one of my clients. She was so morbidly obese, she couldn't fit through the door. And she,
Oh,
had kind of gotten stuck into her own stuff. And I said, well, look, I said, let's just focus on doing something small, like cleaning off the bathroom sink. So that way you can brush your teeth and cleanse your face. And when she came back the next week, I said, so how did you go with the bathroom sink? She goes, I cleaned out the whole bathroom and I repainted it. And I was like,
oh.
that's amazing.
Absolutely.
Rather than
Yeah.
this whole task, we broke it down so teeny tiny small that,
Yeah,
it was just
exactly.
achievable. And then she just went off like a rocket. Like she's just unbelievable.
Absolutely. I mean, that is really what it comes down to, you
Mm.
know? So yeah, fantastic analogies. It's so true. Oh, are we out of time or can we go through this quick? I have
Ah,
many
go
doors
this
left.
through this quick. I'm sure everybody's like, no,
Yeah.
no, no, quick, quick, quick. We want to see it.
So this is just highlighting, what with the evidence-based results that I have witnessed from using this treatment protocol. So just increases in the level of functionality during an episode. Time frame between episodes, which is called the maintenance phase, is increased. The medication efficacy, how we talked a little bit about medication, it's actually increased because when the client really understands what's going on and they start to feel better, you know, um, they actually, if they're like a lot of clients will forget to take their medication, which some of these medications that can be kind of dangerous if they're on them. And so it actually helps with them remembering because they're feeling so great. They actually be like, oh yeah, I feel great. I'll just remember, and they start really remembering to take it. And diagnosing acceptance again ties into that, and their commitment to treatment. And when I say treatment, I'm talking more therapy. And so decreases in the severity of episodes, the frequency of episodes, the duration of each episode, and levels of anxiety, stress, insomnia between and during episodes. All right, moving quickly over, and that is it for my presentation. My book is available at actually, I think it's sold out in Australia on Amazon, but you can get 10% off if you want the paperback or the hard copy from me. Just please go to my website and let me know you're at the conference, and you can order it directly from me, or you can go to the publisher, which is Friesen Press. And but you won't get, they couldn't create a coupon, so I asked them. So it was frustrating. So you wouldn't get the 10% off if you order directly from them. But if you are interested in purchasing it, feel free to contact me through my website, thirdeye hypnotherapy.com, and absolutely I can send you that. And just on the right, you can see what else is in my book. And on the left are a couple, and actually they're both presenting this weekend at the conference. So Dr. Jane Nash is, I included her review, her book review, and Pierre presented earlier today, and his review is there as well on the left.
Pierre was the one that recommended I reach out to you. Isn't he gorgeous?
I he's amazing. Oh my gosh. Yeah, he's wonderful. And he even called me tonight because after, like I said, and I think you're aware, after I watched a few, I thought, oh boy, I did lecture for him, and it's very, very clinical because I'm used to dealing with, psychologists and psychiatrists when because they don't, like I have to, because I am trying to break open this gap, and for them to accept and acknowledge how hypnosis can really help with clients with this illness. And so I have to work with them. I have to talk about my work and my research and why. And it's so clinical and so full of the metrics and the research. And so yeah, when I saw that, I thought, uh-oh,
So I've just
this is not how this conference is going. So he was so wonderful. He called me like an hour before my
gorgeous.
presentation. Yeah, and he's like, "Meera, it's all cool, don't worry." He's like,
You
"You're
deal
good,
with
you're
Trish
good."
now.
So yeah.
So I've
Oh
just
yes,
placed.
he mentioned how wonderful you are and how easy
Aw,
you are to work with. So thank you.
aw.
Yeah, and he
So
definitely reinforced that. Yeah.
I've just put Mira's email inside of the chat. So if you want to get the 10%
Perfect.
off and grab her book, let her know. And maybe she'll sign it for you. Like just put a sneaky tip there,
Absolutely.
like love Mira. And then you'll be like,
Thank
oh
you.
my God, I'm someone famous, someone who started this. So
Oh, you're
yeah.
so cute.
So thank you so much, Mira. Honestly, absolutely amazing. Start saving your pennies so you can come out to Australia for next year, because I'm sure you'll
Awesome.
have a little bit of a
In
fan
person
fan
next
base. A couple
year?
of Val and I will be there going, Mira, Mira.
Oh, sweet. That's wonderful you're doing in person. That's gonna be epic.
Yeah, we're hoping so. So yeah, so thank you
Oh,
so much. Thank you everybody for attending today, and we will be back tomorrow at 8 a.m. Victorian time with the next breakfast panel. We had people rocking up in their onesies and their glasses of wine and stuff like that
oh,
this morning.
sweet.
So tomorrow morning at 8 a.m. is talking about spirituality and hypnosis. Is there a divide? So yeah. All right, lovelies. I will catch
Nice.
everybody in the future. And Mira, go and get a good night's sleep, babe.
Thank you so much. Thanks,
Uh,
Trish.
See you
You
guys.
too.
See ya.
Okay, bye-bye.